Hi, Mrs. Smith. I'm Jordan. I'm going to be your nurse today. So the doctor told me that on your last couple of visits you had high blood pressure, and he wanted me to talk to you about preeclampsia. So preeclampsia is a form of hypertension you can get while pregnant. It's characterized by an elevated blood pressure of any amount compared to your normal baseline, as well as protein in your urine or any damage to any of your organ systems. And so it is a serious condition that we want to be on top of, and we just want to monitor you for now. So I just want to talk to you about it so you can be prepared if it does happen. So preeclampsia usually starts around 20 weeks of gestation, which you're here at 22 weeks, so it could happen around this time. And so it's a very severe condition. There's no cure. Other than having you deliver your baby, which is not needed or desired at this time. So preeclampsia is caused by an abnormal development of the placenta. We don't really know why. There's not much research on it. But some of the risk factors include if you had a history of preeclampsia in your family. I don't know if you do. If it's your first pregnancy, which this is. You don't have hypertension normally, but that is another risk factor. Women past the age of 40 also are at greater risk, which isn't you yet. Obesity, or if you were having twins, would also be risk factors. And so preeclampsia can cause some really severe conditions. These include a lack of blood flow to the placenta, which means your baby wouldn't be getting enough oxygen. Placental abruption, which is when the placenta breaks off from the wall prematurely, and that's really not good. There's also HELLP, which is an abbreviation, and it's a hemolytic disease, meaning that your red blood cells are breaking down, and that puts all different kinds of enzymes and bilirubins and other things into your blood that impact your liver and your kidneys and can cause a lot of problems. Also, if the preeclampsia isn't controlled, it can devolve into eclampsia, which is seizures and possibly a coma, and it's really not good. And at that point, we would need to schedule a C-section to get your baby out. So you don't have this yet. I just wanted to mention it. So there are a couple ways to prevent it. One would be to start taking a calcium supplement. These aren't guaranteed, but they might help. And at this point, your doctor doesn't want you to take a low-dose aspirin, but he might change his mind depending how you continue in your pregnancy. And so some of the symptoms to keep watch for are severe headaches, changes in vision, especially light sensitivity. That would be a huge marker. Shortness of breath. I realize you have a baby growing in there and you're just going to be short of breath anyways, but if you're having a lot of trouble breathing, we want to hear from you. Also, if you're having any upper abdominal pain, that's a time to come in as well. A lot of people with preeclampsia are asymptomatic, which means they have no symptoms, and at that point it's even more serious that you keep coming into your prenatal visits to make sure, so we can monitor to make sure you don't have preeclampsia. When you come in, we'll do different tests. Mostly we'll monitor your blood pressure, see if it's still elevated. We'll check and see if you have any protein in your urine, and then we'll also check your liver and kidney functions. If you're having visual changes, we want to know. Basically, we just want to keep seeing if you're actually developing preeclampsia. If you do, we have a few options of managing it. We would give you some meds to decrease your blood pressure. In addition, we would put you on bed rest, which I know doesn't sound fun, but it is better than hospitalization. So there's that. We would also possibly put you on a corticosteroid. This would help temporarily increase your liver and kidney functions so they aren't being hurt, but that's only temporary. And it would help develop the baby's lungs, so if the baby did have to come out, he would be better prepared for the world. So we aren't there yet. Just wanted to talk to you about it. Do you have any questions?